Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor. And I'm here with my first patient of Friday morning. And I'm just gonna do a full spine, so stay tuned. Thanks for watching. Here we go. So I'm just gonna palpate the spine. We've already done an exam. We already know exactly what's going on. So take a nice deep breath in, all the way up, all the way. Nice, beautiful. One more time. And all the way out. One more. There. That did not want to go, did it? Face me this way. So when a segment does not adjust, we don't increase the force. It's not a fight, it's a dance. Come forward. And we just go around that segment a different way from a different direction. And that's what I had to do with my challenging Isabella this morning, huh? Nice and relaxed all the way. Beautiful. Face me the other way. Tuck the hip forward. Nice and easy. Beautiful. On your back. Go ahead and bend your knees. So should we tell them what's going on with your neck? No comment? Isabella's got very active. She's got some issues that I had to hold off on adjusting her neck until I got the clarification from different studies I had to order. And then after that, I thought, okay, looks like everything's clear. She was not positive in any of those tests that would be giving me a red flag, so we are good there. You're actually not as sore as or as apprehensive as you have been in the past. So a lot of times I mobilize the neck more than adjusting. Relax it. One more. So she is not relaxing and I'm not going to push it. So that's going to be the segment we're going to be mobilizing. Once again, it's never, ever a fight. So so she has a lot of soft tissue issues surrounding the segment that cause the restriction of the segment. And the purpose of the adjustment is not to show her I've got more force than her neck muscles, and we do need to value the signals the body gives. In her case, it's sore. I'm not gonna do something that is sore, obviously, duh. So we're gonna come up with something else that will get the job done without hurting anyone. I'm gonna go ahead and do this. I don't know if you can see this. That's right. Chin up. So I had zero resistance from her, and I got the thumbs up, metaphorically speaking. I'm on the left side. That was a very good adjustment, by the way, if I may say. So with Isabella, she gets an adjustment, and then we go and do, at this point, we're gonna do some developmental kinesiology, DNS, dynamic neuromuscular stabilization, which is what I do in my practice. My wonderful Isabella is a surfer. Well, obviously on the days she comes here first thing in the morning, she doesn't surf, right? Did you surf yesterday?
Yesterday I actually did it.
What?
I know.
What?
I know all week. I only gotta go surf Tuesday, I think, because birthday. I was just tired. I was like,
So the one week she didn't actually surf as much, but she comes here when it's so cold and her hair is wet. I'm like, Isabella, don't take a shower first thing in the morning. Of course, I don't think you even know what cold means, right?
It's not cold.
It's never cold. Not to Isabella.
It's not cold. It's pretty warm out.
So basically, I'm just going to proceed and do a little bit of mobilization here, and that's pretty much what my Isabella's adjustment's like. So thanks for watching. If you have subscribed to my YouTube channel, great. If you haven't, what the heck are you waiting for? Subscribe to the YouTube channel, do the stuff yourself, and come and seek care if you need to. That's the whole purpose. Thanks for watching. Take care.